2024 Retiree Open Enrollment Highlights. Today's presentation is presented by the UCLA Healthcare Facilitator Program, Erica Castillo and Deborah Wells. Today we will cover Open Enrollment Overview, UC Medicare Requirements, Non-UC Medical Plan Overview. We'll give you some tools, resources, and how to make changes. We'll give you information on how to get help, and then we'll conclude with some final reminders. Let's go over the open enrollment materials. Our open enrollment booklets were mailed out the week of October 19th. The university pulled mailing addresses on file as of September 28th of this year. If you moved or changed your address after September 28th, you will need to log on to UCNet to view your booklet online. The first booklet on the left was mailed to UCLA faculty and staff who are still actively working. The booklet in the middle was mailed to UCLA retirees living in California and retirees living outside of California if you have a family member that is not eligible for Medicare. The booklet on the far right was mailed to UCLA retirees living in a state outside of California, and all family members are enrolled in Medicare. Even if you decide not to make any changes next year, we highly suggest that you read and review your booklet for plan highlights, changes, and premiums for next year. As a retiree, your booklet has a special number printed above your name on the envelope. This number signifies or indicates the maximum amount UC will contribute towards your medical and dental premium. If you have a 100 listed above your name, the premiums listed in the booklet apply to you. If you have anything less than 100, the premiums listed in the booklet do not apply to you. You will need to log on to UC Raise to find what your premium will be for next year. Please note that the deadline this year is November 17th at 5:00 p.m. Pacific Standard Time. If you need to make open enrollment changes, they must be completed by this time. We'd like to point out that you may have seen commercials on television or have received information in the mail regarding Medicare's open enrollment. Please do not get these dates confused. The open enrollment does not pertain to you. Therefore, pay attention to UC's deadlines since UC controls your health plan enrollment. We'd also like to point out that there are no pre-existing exclusions on any of our UC plans. This changed as part of the Affordable Care Act legislation. So what happens if you do nothing? If you are satisfied with your current health plans and you do not want to make any open enrollment changes, your current plan selections will automatically continue for next year. You don't need to call RASC. You don't need to call your healthcare facilitator. You don't need to call anyone because it says it in your booklet that it will automatically continue for next year. Open enrollment is the time to consider your options for next year. Are you satisfied with your current medical and dental plan options? Have you recently married or need to add or remove a family member? Are you aging into Medicare next year? Have your health needs changed or do you need more flexibility? If you previously suspended your UC Health plan, do you need to unsuspend? This is the time to make those changes. Now let's go over the 2024 retiree premiums. Your medical plan premiums are listed in your booklet starting around page 8. Again, the premiums listed are for retirees eligible for 100% of the maximum UC contribution. Many retirees want to know if they're eligible for the Medicare Part B reimbursement. A retiree is eligible for the Medicare Part B reimbursement only if their premium is 0. If you are eligible for a Medicare Part B reimbursement, you will see a credit each month in your pension income. See the plan cost key here? The top number in bold is what you will pay. The number below is the Medicare Part B reimbursement. Keep in mind that if you receive a Part B reimbursement now, if the total medical plan premium changes for next year, you may see an adjustment in your Part B reimbursement. If you are a retiree and have enrolled in a non-UC Medicare plan, you are not entitled to a reimbursement. This is only for retirees enrolled in a UC-sponsored medical plan. Throughout the year, we often receive phone calls from retirees needing to understand their deductions. If you take a look at your pay stub, you will see a description of your deductions similar to this. The MED-MBR PREM stands for Medical Member Premium. So that's what you pay. That is what the retiree pays. The retiree is the member, MBR. When you see MED, ER, PREM, that means Medical Employer Premium. That's what the university pays. The ER, employer, is the university. For those who are in a Medicare plan and may receive a Medicare Part B reimbursement, you will see this as a credit, again, on your monthly pension check. Here are the premiums for 2024 for our non-Medicare retirees. We've highlighted the 2024 premiums in red. Here you can compare the difference from this year's premiums to what you will pay for next year. Again, these premiums are for retirees who are eligible for 100% of the UC contribution. These are the rates for 2024 for retirees enrolled in Medicare, and all covered dependents are also on Medicare. As you will notice, only Kaiser Senior Advantage, UC Medicare Choice, and UC Medicare PPO without prescription drug coverage are the only plans that offer a Part B reimbursement. The UC Medicare PPO and UC High Option plans do not have a Part B reimbursement, and that's because the cost of the plans are higher than the UC contribution. Therefore, you pay the difference in premium. Here are the premiums for 2024 for our non-Medicare retirees who are age 65 or older and not eligible for Medicare. These are the rates for retirees with a split or mixed Medicare and non-Medicare family members, meaning that you have some family members enrolled in Medicare and some family members who are not enrolled in Medicare. Now let's go over UC Medicare requirements. Medicare enrollment is mandatory for all retirees and their family members if you are eligible for premium-free Medicare Part A. If Part A is premium-free, you must enroll in Medicare Part B. UC relies on Medicare to offset the cost of insurance. Retirees over age 65 without Medicare cost twice as much or more to insure. Medicare partially reduces the cost, which keeps the UC premiums affordable, which allow UC to continue to fund health benefits for retirees. To enroll in a UC-sponsored Medicare plan, your Medicare ID card must reflect both Part A and Part B. Failure to comply may result in penalties and permanent loss of UC-sponsored medical coverage. But there is an exception, and that's those who retired prior to July 1st, 1991, or retirees who reside outside of the United States. Keep in mind, if you move back to the USA, UC will require you to enroll in Medicare. So you may have a Medicare late enrollment penalty if you did not pay into Medicare if you were not paying Medicare premiums while living abroad. Everything you need to know can be found in the Medicare fact sheet available online at UCNet. Once you are retired, if you have some family members who are eligible for Medicare and other family members who are not currently eligible for Medicare, you're considered a split or mixed Medicare family. The non-Medicare family members will be in the non-Medicare plan, and the Medicare family members will be in the Medicare plan. The retiree is the driver of the medical plan. If the retiree is in UC Blue and Gold, your Medicare family members will be in UC Medicare Choice PPO. If the retiree is enrolled in Kaiser Senior Advantage, the non-Medicare family members will be enrolled in Kaiser Permanente. Follow this grid to see what plan you are enrolled in, and if you have Medicare family members, the column in the middle will show you the required prescription drug form that needs to be completed and turned in for open enrollment. If you are currently enrolled in the UC Health Savings Plan, once you or any of your enrolled family members enroll in Medicare, you must immediately disenroll from this plan and enroll in another UC medical plan. This rule is not only set by UC, but it's also a rule by the IRS. Here are the 2024 Medicare premiums. Most of us have paid into Social Security and have earned Medicare Part A for free. When it comes to Medicare Part B, everyone has a premium to pay, and they are paid by you, the retiree. If you are collecting Social Security, it will come out of your monthly Social Security benefit. Or if you decide to delay collecting your Social Security benefit, you will make payment arrangements directly with Social Security and make quarterly payments. Or you can set up monthly automatic payments through Easy Pay direct with Social Security Administration. Next year, for individuals enrolling in Medicare Part B, the standard premium will be $174.70. Also, if you are higher income, you may also be charged a separate Part D surcharge called IRMA. Everything you need to know about your Medicare premium or how your premium is calculated can be answered by contacting the Social Security Administration. Some individuals do not qualify for Medicare on their own. Therefore, if you do not pay into Social Security, If you did not pay into Social Security nor earn 40 credits elsewhere, you may qualify under your current spouse work record when they age 62. Or if you are currently single but was previously married at least 10 years, you may qualify under your former spouse if they are eligible for Social Security benefits when they age 62. It's very important that you know the facts about Medicare and what UC requires of you so that you are not penalized later. Remember, it's not 65 that you could qualify under a spouse or former spouse. It's 62. Many retirees don't realize this, or they forget about this until their spouse is aging 65, and then they contact Social Security, and that's when they find out they have a 3-year penalty because they did not apply for Medicare under their spouse's record when their spouse aged 62. Again, this only applies if you do not qualify, if you did not pay into Social Security and you don't qualify for Social Security under your own work record. If you age into Medicare after you retire, UC will send you instructions about Medicare on when to enroll and how to enroll in Medicare. In this example, I show a retiree aging in Medicare in the month of April. 90 days or 3 months before their 65th birthday month, UC will send a notice to enroll in Medicare Part A and Part B. If there is no response in the month that they age 65, the following month, a penalty will apply of $419.60. The university will continue to penalize you every single month until you return your form. If after 3 months you still do not have your Medicare form submitted to RASC, at that point you could lose your coverage permanently. Now, if you are not eligible for Medicare, make sure you request a denial letter from Social Security and submit that to the RASC. Otherwise, you could still be penalized. Now let's go over the 2024 medical plan overview. The medical plans being offered this year will be the same for next year. For our non-medical Medicare plans, we have the PPO plans administered by Anthem Blue Cross, which are UC Care, Core, the UC Health Savings Plan. We have the UC Blue and Gold, and that's administered by HealthNet and Kaiser Permanente. These 2 plans are your HMO plans. We have 3 Medicare supplement plans administered by Anthem Blue Cross, which is UC Medicare PPO and UC Medicare PPO without prescription drug coverage, and UC High Option. For Medicare retirees living within California, we have Kaiser Senior Advantage and UC Medicare Choice administered by the United Healthcare, which is an Advantage PPO plan. UC continues to offer a Medicare coordinated program through VIA Benefits for Medicare retirees living outside of California. On the far right are the non-medical plan options for next year. Depending on where you live will determine your option for next year. Geography is key. Plans listed in black print are the non-Medicare plans. Plans listed in red print are the Medicare plans. I will point out that if you are or plan to live abroad, the only 2 options are the UC Care and UC Core plan. Medicare will not pay for services outside of the United States. That is because it is a USA federal government program. Now let's go over UC Blue and Gold and the UC Medicare Choice Plan. For the UC Blue and Gold, The plan changes for next year are listed as follow. Male sterilization, sterilization of males in provider's office or outpatient hospital setting will change from a $20 copay to a $0 copay. The FDA-approved over-the-counter contraceptive drugs and devices will not require prescription to be covered at a $0 copay next year. The Behavioral Health Administration transition from MHN to the Health Net Behavioral Health will have no impact to you. The provider network and benefits will also transition on January 1st, 2024. HealthNet moved from Babylon to Teladoc for telehealth coverage effective August 10th, 2023. We've listed the Teladoc number here as well as their website. Omada will be replaced by ShareCare, Eat Right Now, a digital weight loss and diabetes prevention program. For more information about open enrollment changes or to discuss your questions about the UC Blue and Gold plan, contact the Health Benefit Navigator at 1-800-539-4072, Monday through Friday, 8 to 8 p.m. Pacific Standard Time. This is a team of experienced HealthNet customer service representatives dedicated to UC with extensive training on the UC Blue and Gold HMO plan. Now here we have a side-by-side comparison with a UC Blue and Gold compared to the UC Medicare Choice Advantage plan. And this is just a side-by-side comparison, just in case you're happening to change or become eligible for Medicare for next year. The copays, if you are in this plan currently, you will see that the copays remain the same for next year. New for 2024 are state licensed MFTs and MFCCs can bill United Healthcare directly. So these are all of your counselors, marriage and family therapists. For UC Medicare Choice, the prescription out-of-pocket maximum will increase to $8,000. So the changes for next year, we have listed here in red print. Everything else will remain the same. Now we will go over Kaiser Permanente and Kaiser Senior Advantage. For Kaiser, the open enrollment changes are listed here. The pre-enrollment toll-free number is 1-800-324-9208, Monday through Friday, 7 o'clock to 6 o'clock p.m. Pacific Standard Time. This is new for Kaiser because it's now available for Medicare members. They are also offering virtual 15-minute appointments, and new for next year or for this year open enrollment is that they now offer Spanish. You can take a picture of this QR code to learn more. If you're aging into Medicare soon, you may be interested and find it highly useful to attend Kaiser's monthly Medicare 101 workshops. All this information can be found online on UCNet or by contacting Kaiser directly. For Kaiser Permanente, other changes are the insulin administration devices and generic drugs are changing from a $3 copay to a $0 copay. Brand name and specialty drugs are changing from a $10 copay to a $0 copay. And we are discontinuing the post-discharge mail delivery for Kaiser Senior Advantage. Kaiser offers the away-from-home travel services through their Visiting Member Program. Additional benefits and offerings in addition to Kaiser Permanente facilities are listed here. To learn more, members can call 1-951-268-3900 to speak with the Kaiser Member Services representative. There are no changes to the Kaiser plan copays for 2024. We like to point out, however, that under the Optum Behavioral Health, under the ABA program for autism, the copay will go down from a $20 copay to a $0 copay for therapy services. For Kaiser Senior Advantage, the prescription out-of-pocket maximum will increase to $8,000. Again, open enrollment changes for next year are listed in red print. Now let's cover the 2024 Anthem PPO plans. Accolade will continue in 2024. They provide utilization management, provider services, and clinical support for our non-Medicare plans. In addition to providing customer service, they offer clinical support, virtual care, second opinion assistance, assist you with understanding a diagnosis by a licensed nurse. Accolade's phone number is 1-866-406-1185. You can log on to Accolade website and create your personal member portal. For more information, contact Accolade. They're there to assist you. New for 2024 are the male and female condom will remain at a zero cost share for you, but new is that it's no prescription will be required for next year. In-network male sterilization or vasectomy will be a zero cost share. A deductible applies for the UC Health Savings Plan and the Core Plan. For out-of-network vasectomy member cost share remains the same. The Health Savings Plan at 40% after deductible, UC Care at 50% after the deductible, and the Core at 20% after you have met your deductible. As you know, UC Care consists of 3 tiers. Your out-of-pocket cost depends on where your services are rendered. Tier 1 includes all UC Select providers, UCLA Health, UC San Diego, UC Irvine, UC San Francisco, or UC Davis. Tier 2 includes all Anthem preferred providers, meaning contracted providers. And Tier 3 includes all out-of-network providers, meaning they are not contracted with Anthem and they are outside of a UC provider's office. The UC Health Savings Plan is not open for new enrollment. The Health Savings Plan account maximum contribution for next year is increasing. The maximum health savings account contribution are shown here for single coverage, which will be $4,150, as well as a family coverage, which will be $8,300. UC's contribution toward the UC Health Savings account remains the same. The catch-up contribution for those aged 55 and older will remain at $1,000. The Core Medical Plan is a non-Medicare PPO plan with worldwide coverage. The calendar year deductible remains at $3,000. The out-of-pocket maximum remains the same. Preventive services are covered in full and not subject to the calendar year deductible. As you can see, everything will remain the same for next year. For the UC Medicare PPO plan, there are no significant changes to the UC Medicare PPO plan other than the annual out-of-pocket maximum, again highlighted in red ink. The out-of-pocket maximum is going up from $7,400 to $8,000 for next year. The UC High Option Supplement to Medicare has minimal changes as well. For 2024, the annual out-of-pocket maximum for prescription drug is going from $7,400 to $8,000. Between Medicare and your Anthem Blue Cross supplement plan, most services are covered in full at 100%. The calendar year deductible remains at $50. The out-of-pocket maximum remains at $1,050 for medical per member. As you can see, same benefits this year will remain for next year. Now we'll go over VIA benefits. UC's Medicare Coordinator Program. If you're a retiree living in a state outside of California and all family members are enrolled in Medicare, you should have received this booklet. Your open enrollment dates and instructions are different than retirees living in California. If you haven't received your booklet, log into UC Raise and verify your address is correct or contact the RASC. VIA Benefits is UC's Medicare Coordinating Program for retirees living in a state outside of California when all family members must be enrolled in Medicare Parts A and Part B. This program offers more local plan choices, including Kaiser, where available. It offers more value plans to fit every budget, more flexibility, and more support. UC will provide an annual contribution for each covered family member under the health reimbursement account. So if it's you and you have a spouse enrolled on your plan and you both are enrolled in the VIA Benefits plan, meaning you both have Medicare, for a retiree, if you worked 20 years or more, you, the retiree, will receive $3,000 in your health reimbursement account, and your spouse will also receive $3,000 in their health reimbursement account. Each covered family member will choose an individual plan that's best for them. You don't have to be in the same plan when you're going through VIA Benefits. You use your health reimbursement account funds to pay for your Medicare supplement plan, your Medicare Part B premiums or Part D premiums, you can be reimbursed as well as some out-of-pocket costs like prescription copays or office visit copays. During open enrollment, retirees must submit paper forms to enroll or make changes to their dental or vision or legal plans. Now we'll go over the non-medical plans. For Delta Dental, PPO, Delta Dental continues as the vendor. There are no benefit changes. Delta Care, USA, HMO, Delta Dental continues as the vendor. There are no benefit changes. UC pays 100% of the monthly premium for retirees who are eligible for the full UC contribution. If you are currently enrolled, your coverage will continue for next year. The dental plans are open for enrollment. Remember, the number on your envelope above your name signifies what you're eligible for. So if you have anything less than 100, you're considered graduated eligibility, and you could have a premium to pay for next year. For the vision benefits, VSP continues as the vendor. There are no benefit changes. Premiums will remain the same. There are no UC contribution. For any retiree, all retirees must make payment arrangements directly with VSP. If you're currently enrolled, your coverage will continue. Just make sure you keep up with your payments. It is open for enrollment. If you need to enroll for next year, you have two options. You can go online to enroll, or you can call this number 1-866-240-8344 to enroll. For the legal plan, AllRock continues as the provider. There are no benefit changes. Premiums will remain the same. There's no UC contribution. Premiums are deducted from a retiree's monthly pension. If you are currently enrolled, your coverage will continue for next year, and it is open for enrollment if you need to enroll. For accidental death and dismemberment, AD&D, Prudential Life continues as the AD&D provider. There are no benefit changes. Premiums will remain the same. There is no UC contribution. Retirees must make payment arrangements directly with Prudential. If you are currently enrolled, your coverage will continue as long as you keep up your payments. If you need to enroll, call 1-800-524-0542 or log on to UCNet and download the form. AD&D is always open throughout the entire year for enrollment. Pet insurance. Nationwide continues as the vendor. Exclusive plan with preferred pricing just for the University of California. Coverage for cats, dogs, birds, small mammal, and exotic pets. Livestock are excluded, including horses. Rates are best based on species of the animal and the state of residence. There is no UC contribution. It's 100% retiree paid through direct bill to Nationwide. If you are currently enrolled, your coverage will continue as long as you keep your payments current. It's always open throughout the entire year for enrollment. To enroll, we included the link here, or you can call 877-738-7874 for more information. Now we want to give you some tools you can use. There are many tools you can use to help you with open enrollment. To get started, you first need to log on to ucal.us/OE. Then click on Get Started. Then click on Retirees. If you have not received your open enrollment booklet or misplaced your booklet, here you will find the retiree booklets for retirees living in California and retirees living in a state outside of California. There is also the Medical Plans tab. Click here to find the plan changes, compare plans, and plan cost. There is also the Which Medicare Plan is Right for You and the Which Medical Plan is Right for You links for you to compare the medical plans side by side. Now, how to make changes. When you're ready to make your changes, click on UC Raise. If you log into UCNet and you do not see UC Raise, click on the Sign In drop-down tab to your accounts and follow the instructions. Once you're logged in, click on Open Enrollment. If you need to add a family member, click on this tab. If you need to remove a family member, you can make the update here also. To change plans or suspend coverage, click on this tab. You can also click on this tab to find out what your premium will be for next year. You must confirm changes. You must confirm your changes. You must confirm your changes to receive your confirmation number. Otherwise, your changes will not take effect. If you're unable to make changes online through UC Raise or you recently retired, call the RASC at 1-800-888-8267 from 7 a.m. to 4:30 p.m. These are new hours just for open enrollment. Or you can submit a paper form, the UBEN 100 form, but you need to make sure that it's received and postmarked by November 17th, 5:00 p.m. If you're Medicare eligible, you must also submit the Medicare prescription drug form by November 27th if you change to a new Medicare plan for next year. Anthem Blue Cross plans, you need to use the UBEN 123 form. If you're switching from the UC Medicare PPO to high option or switching from high option to the UC Medicare PPO, a new UBEN 123 form is not required. If you're switching to Kaiser Senior Advantage, use the UBEN 127. If you're switching to the UC Medicare Choice PPO, use the UBEN 121 form. Fax your forms to the RASC at 1-800-792-5178. It must be received by the deadline. Or you can mail your forms to the RASC at P.O. Box 24570, Oakland, California, 94623. Again, it must be postmarked by the deadline. The address and fax number are listed on all the forms. Remember, these forms are only required if you're making a change. If you are not changing and you're satisfied with your current plans, you do not need to do anything. If you are the retiree or survivor and enrolled in a UC medical plan and either you or a covered family member is enrolled in a UC-sponsored Medicare plan, the UBEN 101 form must be completed only if you disenroll or cancel a Medicare family member from your plan, only if you suspend your medical plan, which covers a Medicare member, only if you disenroll from any Medicare plan and enroll in a UC Medicare PPO without prescription drug coverage plan. Now, if you have any questions about this form, call the RASC at 1-800-888-8267 or contact your healthcare facilitator office. If you experience a qualifying event outside of open enrollment, you can make a change within 31 days of that qualifying event. A qualifying event is if you're moving outside of your planned service area, you have an involuntary loss of coverage, you get married, or add an addition to your family. These are considered qualifying events, and you don't have to wait for open enrollment to make a change. Again, you can immediately enroll or make changes if you have a qualifying event that's listed here. You have 31 days to enroll. Now I want to go over the member ID cards. You may not think about your health plan insurance ID card until you or your doctor or your provider ask you for information. The appropriate ID card must be presented to obtain benefits for services. Every year, you should make it a point to find out if your plan will be issuing new ID cards. Over the years, I have found that many retirees and employees are carrying the wrong health plan ID card or no ID card at all. You can prevent being denied services by simply presenting the most updated ID card to your provider or pharmacy. All ID cards should be received by the first of the year. If you do not receive your ID card, please contact the plan directly. Contact the plan directly. Do not call your healthcare facilitator. Do not contact the RASC. We do not issue ID cards. You must contact the plan directly. Now I want to go over our UCLA Health providers. During open enrollment, if you would like to have access to UCLA Health providers by enrolling in the UC Blue and Gold, Core, UC Medicare PPO, High Option, or UC Medicare Choice, you will have access to our primary care and specialty care services. If you need help finding a doctor who's right for you, call UCLA Health at 310-825-2631, Monday through Friday, 7 a.m. to 7 p.m. Pacific Standard Time. Here is a list of all the UCLA Health locations. To search for a UCLA provider, click on the link here. Now I want to talk a little bit about our Healthcare Facilitator program. The Healthcare Facilitator program assists UCLA employees and retirees. We serve over 56,000 active and over 17,000 retired faculty and staff, as well as the family members. We ask that you be your own advocate as much as possible before contacting us. Here are some things you can do to take time to understand your benefits. Make sure you review your evidence of coverage booklets on UCNet. Contact your health plans. They can assist you with second opinions, pharmacy-related questions. They can go over your plan coverage, what's covered, what's not covered. You can contact your medical billing office for questions on a bill you may receive because you want to make sure they have your most recent, your current updated information off your ID card. Our contact information, if you need to reach us, is listed below. Erica Castillo assists employees and retirees with last names A through K. And myself, Deborah Wells, I serve employees and retirees with last names L through Z. Again, as much as you can, be your own advocate. Understand your benefits and try to assist and find the answers to your questions on your own. But if you've already exhausted all your resources and you've already contacted the plan and you still are having issues, of course we want you to contact us. We are here to assist you. Just keep in mind that we do serve a large population and it may take some time for us to get back to you. Now I want to go over some tools and resources. Listed on this page are resources you may find helpful. I've included the steps retirees should use when you are ready to review your open enrollment information. Everything you need to know about your UC health and welfare benefits can be found on UCNet. The annual open enrollment information is listed here. The evidence of coverage booklets are listed here, and the Medicare fact sheet can be found here. If you need to contact the RASC, I have listed their information here. I have also listed CMS, Social Security, and HICAP here as well. When it comes to Medicare questions and Social Security benefits and information, these are the experts to address your questions. Now, as we wrap up, I want to conclude with some final reminders. Number one, make sure you read your open enrollment booklet from cover to cover. We always get the question every year. Our phones are ringing. Do I need to make a change? Do I need to do anything if I don't want to make any changes? And it's in your booklet. If you read your booklet, you will see if you want to keep your same plans, you don't need to do anything. So please read your open enrollment booklets, review the pre-recorded presentations and materials, confirm your changes if you're going to make a change, and make sure you get a confirmation. If you are eligible for Medicare, make sure your Medicare forms are received by November 27th. If you're switching plans and you need to complete a Medicare form. If you are satisfied with your current health plan options, again, you do not need to do anything, but we highly suggest that you log in to review your current enrollments, make sure everybody that you want covered is covered, make sure anybody that you don't want covered is taken off, review the premiums so you know if your paycheck for January 1st is going up or down. If you need to add any new family members, make sure you look out for a letter from Unify HR around the month of February. They're going to be requesting documentation for you to verify that eligibility of that new dependent. Don't disregard this notice because that family member that you added will be dropped off the plan if you don't do the verification. If you change plans, look for your new ID cards in the mail and file your old cards away in a safe place. File them away in a safe place. Don't throw them away because you may need to refer back to it at a later date. Open enrollment again ends on November 17th at 5:00 p.m. Pacific Standard Time. If you have a question after reviewing this presentation, we invite you to attend one of our retiree open enrollment help desk sessions. We will be available to answer your questions live. Since this is our busiest time of year and our two-person team serves over 17,000 retirees, we encourage you to attend one of our help desk sessions for general questions. To register for a session, click on this link. You do not need to attend every single session. You only need to attend one. But if you have more questions, you're more than welcome to attend another session. If you have a complex question about open enrollment, or you're in the middle of treatment and planning to change plans and need transition of care assistance, contact the health plan directly. We want to thank you for attending this open enrollment presentation. We hope you find this information helpful.